Good morning. Welcome back. It's Gary and myself here again to talk about COVID. As I was thinking about how long this has been, we started these videos back in April, I believe, to inform everybody about the rapidly changing events. And I really do think, in retrospect, we all thought at the time it'd be done by July or so. We get through this thing, and then, of course, more recently, people where you hear all the talk about, 2020 is behind us, and boy, that's so good to have it behind us. But as it turns out, 2021 is just a change in a digit on the calendar. January was a bad month. So unfortunately, we're here to talk more about COVID. So let's see if we can learn some more information. Gary, what's new on the COVID front?
Well, the good news is that we are on the backside of the second wave, and we're beyond the peak of the second wave. I think the second wave was going to be the worst. We may see a third wave. Maybe it'll be Super Bowl Sunday, so I have to be careful about that. And right now, the world is following the new variants. So as the virus mutates, and as new variants pop up and they become more fit or more transmissible, we're following those new variants. There's 3 of them. We try not to delineate it by countries. So the UK one is called B117. There's a new variant in South Africa, and one out of Brazil. The UK one has been circulating in the US and in about 115 other countries. And California and Florida have the most cases in the US of the UK variant. It might be one of the reasons why Southern California is struggling. As we study the variants, we know that they're more transmissible, they're more contagious, but they don't appear more virulent. That's a little bit controversial with the UK one, because the Prime Minister made a comment that maybe it is, but we really haven't seen the data for that. But the South Africa one and the Brazil one do not seem more virulent, just more contagious. And the real question is, are the variants going to work with the vaccine? The South Africa one seems to have mutated the most, and we think that according to the Johnson & Johnson vaccine, that it might lose about 15% of its efficacy. So the Johnson & Johnson vaccine, the data is 85% effective with the strain that's circulating in the world now. And with the South African one, maybe it'll lose 15% of that.
Okay. Is it safe to say, or logical to say, that all these variants will eventually hit the United States?
Yeah, so I think what's going to happen is we're going to experience all of the variants, and other ones are coming up. There actually is a variant in California, came out of Santa Clara. There are 2 variants in Ohio that have come up that are being studied. And so the world is tracking the mutations, and we're following the virus so closely. Unlike anything we've ever seen before, an mRNA virus is going to mutate. That's what it does, just like the flu. And we can expect the variants to come up. It's going to follow Darwinian principles. The purpose of the virus is to be propagating itself. And so if it's more transmissible, it will outcompete other viruses. If it's less virulent, then the host will survive and infect other people because the illness will be mild. So over time, like in 1918 with the influenza virus, over time in the years following, the virus did mutate, it did adapt, did adjust, and it became less virulent, more transmissible.
Okay. Now, even when you talk about a variant that's more virulent and impacts 15%, say, on a given vaccine, first of all, define what is the efficacy. Let's say a vaccine is 85% effective. What does that mean?
Yeah, it depends on how you design the study. But what we think it means is that 85% of people that get the vaccine will be protected from severe illness.
Okay. They
might still get infected. And we think that 72, if you talk about the Johnson & Johnson vaccine, if it's 85% effective against severe illness, it's about 72% effective about having any symptoms at all of COVID. But you still might get infected, and you just may have asymptomatic illness with that.
Okay.
And so like the flu vaccine, we know that the flu vaccine is not 100%. Some years, if we miss it, it's 10% effective. On a good year, it's 50 to 60% effective. But you can still get the flu if you get the flu vaccine, but you're going to have a milder case or maybe no symptoms at all. So that's why even with the vaccine strategy, we still need to do the public health measures. We still need to be careful about social distancing, be careful about mixing. It's a big question, should schools go back in? And so there's a lot of public health measures that we won't let up on based on vaccination alone.
So then when you put it in the context of the flu vaccine, all these vaccines are still highly effective,
Yeah, so
relatively speaking.
absolutely. I mean, we really were, the FDA said they are not going to approve a vaccine that's not 50% or more effective, because that's kind of where the flu vaccine comes in.
Yeah.
And then our first vaccine out was 95% effective.
Mm-hmm.
Well, that was a home run. Even 85% effective
Yeah.
for the AstraZeneca and the Johnson & Johnson vaccines is really an incredible success.
Great, thank you. The natural move from that is, what are we doing with vaccines? So I wanted to give you an update on our vaccine clinics, because as Gary stated, despite all this noise about the variants, our mission is still to use the vaccines at hand to vaccinate our entire community. Currently, we have 3 clinics running now 5 days a week. At Stony Circle, we're doing 40 vaccines a day. At Airway, we're doing 180 today, and at Luther Burbank, we're doing about 610 vaccines a day. Now you can anticipate that in about 2 weeks, the first people who receive the vaccine are coming back for their second dose, so all these sites will be doubling in their volume. Which brings up the question about staffing, and we do have additional staff coming in the next 2 weeks who are going to be dedicated to the vaccine clinics. So the goal of all of us is to continue to support our clinical operations in the fashion we are right now, pushing out the vaccine without any further impact from a staffing viewpoint. The individuals who are still in that tier of greater than 75-year-old and healthcare workers, we've pretty much done that now, and by that I mean all the Sutter patients who have MHO over the age of 75 have received at least 2 emails. Those of them who failed to open their emails have received at least 2 phone calls, and those individuals without MHO have actually been called twice. So we feel like we've exhausted that category, and that is just a prelude to say, a little known secret, but Sutter will be announcing tomorrow that we are moving down to age 65. It's actually going out to those over the age of 65 on MHO this evening. So those people specifically over the age of 85 will get one email with a link to the site where it has the phone number and the MHO appointment option. And then they're sending out 600,000 emails to our general population explaining this, but not giving them access to that link. So Sutter has added more servers to My Health Online, because you recall when they first started, things crashed. So we anticipate there will be a run on appointments. This will hit the news undoubtedly. So expect it to be a little rocky. You know, this is what happens. You've seen this with the county. We've seen this with everybody else. You open up a clinic that's for a narrow segment, and word gets out, and you get a run on that. And we've seen that too. And in fact, it's useful to know that while our mission that was given to us by the county was to vaccinate our Sutter patients, a fair amount of the vaccines we're delivering are just to our general community who are showing up at our site. So we are doing that mission. I do want to remind you that there are only 2 ways for patients to make an appointment, and we really ask that you stick with that they can call that 800 number, or they can do it online. And so we ask that you not try to interfere with that process or ask your office staff to do it. We don't want that appointment process to overflow our clinical operations. We really do want to keep it separate. And certainly we do not encourage anybody to tell patients to just walk in or show up. And all this information is spelled out to them on their My Health Online. Volunteers. So we are open to our providers of the group volunteering. The mechanism that we've set up is you can contact Erica McGuire. Just let her know perhaps what day of the week you might be available to volunteer. The process is such that if you're a current active SMGR employee, you are required to do the health stream, and we've sent that link out. There's 2 courses. And if you are an IC or a retired SMGR physician, there is a link, so those people can contact Erica first, and she'll give them a link to a similar course on the Public Health Department site. There's an attestation. For retired physicians or retired APCs, we are actually only encouraging volunteers from those whom have been a part of SMGR in the past. So we're not asking for volunteers outside of that body, and you are required to have an active license if you're coming back. So that is where we're at right now. I would encourage everybody, if you have a chance, to pop into the Luther Burbank, and I know you've been there a lot, Gary, the Luther Burbank vaccine site. It is quite a process. It's amazing to see what they've done. I will say it's, everybody is working very hard to get people vaccinated as fast as possible. And I do ask everybody just to be patient. The logistics behind this, and most of us are not aware of that, are just mind-boggling in terms of security and the appointment process and the number of volunteers and staff to coordinate the supply of the vaccine, which is turning out to be the biggest problem we have, is getting the vaccine. And then the handling of the vaccine. Some of them have to be ultra frozen, and evidently the Pfizer one, if you shake it twice, you've completely eradicated its potency. Has to be drawn up by a pharmacist. A lot of logistics going on. So please be patient. Let's not be critical about the process. Be patient with those people who are involved in the vaccine clinics. Be patient with the staff who are, shall I say, left behind in our offices to continue the clinical work with perhaps not as much peer-to-peer support as they've had in the past. But this is a critical task, and we're doing this for our community. So thanks for your part in it. So thanks for listening this morning. Hope this has been useful again. Keep up the hard work.